And so I'm going to just read off a list of different types of symptoms that we have found respond to NRCT. So headaches and migraines, many of these are things that people have mentioned on on this video already. Chronic fatigue, fibromyalgia, digestive disturbance, you were mentioning that. Difficulty sleeping, and if you have chronic pain, there's often difficulty sleeping. High blood pressure, brain fog.
What does that mean?
Brain fog.
I can tell you all about that.
Yeah, if you have brain fog, it's just like you can't think, things are slow,
Like
the words don't come quickly, it's like you have a constant feeling like you've got a cold or flu all the time without the fever and chills. Failed surgeries. This is a situation where someone has gone in for surgery and the surgery didn't work. And if surgery is dealing with the underlying cause, it should have some positive benefit, right? But if they're actually, they think something's going on and that's the cause, but they do the surgery, it's either they screwed up the surgery or the surgery wasn't actually addressing the cause. That's what a failed surgery is. There's a patient I'd seen for acupuncture many years ago who came back in, she had pain, she's a nurse. She was having pain in her arms. She was off work. I worked doing the NRCT. We got significant and then total reversal of all the pain and the numbness going out of her arms. She was scheduled for surgery. And so she didn't really need the surgery because obviously what we were doing was dealing with the underlying cause. But work comp would not take my word as a physician's word comp, but as an acupuncturist. I could put her on temporary total disability for an extra 3 months to recover. So she went ahead and had neck surgery just so she could have the time off. I mean, that's how screwed up the system. And luckily the surgery didn't screw up what we had done. She came in, I did some work and she is okay. But that can happen. So this is like the opposite of failed surgery. It's like a failure to actually have to have a surgery. Parkinson's disease, mild to severe body pain, RSD, reflex sympathetic dystrophy, trigeminal neuralgia, arthritis, nervousness, dizziness, Lyme disease, multiple sclerosis, difficulty breathing. And this list is in your notes, so you don't have to write it down. Feeling exhausted when you wake up, numbness and tingling in arms or legs, communication problems, a severe low back pain or hip pain, emotional difficulties, and many other symptoms. So I'd like you to fill out this survey at the moment. I do have some extra pens if you need one. You want to take a pen? You can fill out the survey. You have a pencil. And just very quickly go through that. And so filling this out, filling out the survey part of the symptoms will help clarify kind of what's going on in your own mind too. And so as I'm talking, you better understand what might be going on. Okay, while you're doing that, I'm going to go ahead. And essentially, if you checked off any symptoms, raise your hand if you checked off any symptoms. Everyone should have because you're here for that. It means that something's wrong in your body. Symptoms are the last thing that happens in the body. Dysfunction starts to happen, then disease, then symptoms. Symptoms are not the first thing. We actually develop dysfunction. Once dysfunction gets deep enough, then we have disease, then we have some symptoms. It's never normal to have a symptom. It comes about naturally, but it's not considered, we don't consider it normal. You aren't normal if you have a symptom. It might be common. A lot of people might have allergies because they moved here from somewhere else. Many people might have symptoms of flu if it's the flu season. That doesn't mean it's normal to have flu. It doesn't mean it's normal to have allergies. It just means it's common. So a symptom is your body's way of telling you that something's wrong and you should have an evaluation to find the cause. So all the different symptoms that I mentioned in that list may be due to one cause. Not necessarily, but may be. And that's the loss of the normal function of the nerves in your body. Now, this can come about from stress on those nerves. And it could be a lack of nutrients. They aren't getting the nutrients they need. There could be stretching or tension on the nerves, or direct pressure on the nerves. If you sit in a strange position with your legs, then they might fall asleep. Right? Ever had that feeling? Yeah. And so as it's coming back, then it might be really painful, and then it gets warm and it feels normal again. Those are different stages of the return of blood flow to that part of the body and to the relief of pressure on the nerves. So that's why things fall asleep, because either blood circulation is dropping off or the nerves being impacted. Yeah. And I've never heard of any particular medication that requires you to walk an hour a day, but walking an hour a day is a fantastic prescription in and of itself. Your heart or something?
Yeah, I had a heart attack.
Circulation?
So I had about 300.
Oh, you have? Wow. Wow, that's a lot. Yeah, definitely exercise. So, all the nerves in the body, including the brain and the spinal cord, have a coating that surrounds them. Trauma to any nerve in the body, whether in the hand or foot, can cause a pulling of this coating called the meninges. Anyone heard of meninges before?
Meningitis.
Meningitis. Most people have heard of meningitis. But the meninges themselves is something most people don't know, and many physicians really disregard it. They don't really think that much about it until a problem happens. Now here, I brought along a friend of mine to help demonstrate. This is, I just pull off the skull at the top of the head here. And so we got this brain here. All right? Pulling out the brain on my friend. And the brain, as you can see, has got lots of crevices in it. Brain is something about the consistency of tofu or cottage cheese. All right? Now, if you hit tofu a number of times, then it'll start to crack. You know? So, which is why they store it in water. Well, our brain is also stored in a fluid sac, and the meninges surround the brain. There's 3 layers of meninges. So it's sort of like having saran wrap. All right? If you think of the meninges as some sort of plastic wrap, I guess I shouldn't say saran wrap, but it's plastic wrap. Unless they pay me to say saran wrap. So it's like having 3 layers of some sort of plastic wrap, totally surrounding every little crevice in the brain stem, and the spinal cord. Now, between the different layers of the meninges, different things flow. So, has anyone heard of the blood-brain barrier? And so the blood-brain barrier is there. It's sort of a wall, a protective wall to keep the brain from getting attacked by viruses and bacteria, things like that. We don't want the brain to get bacterial infection or viral infection. So I'm just sort of pulling the brain apart here. So this part here, this is the cerebrum, which is the neocortex, the new part. And as we start taking it apart, you can see there's deeper layers here. The deeper layer is called the reptilian brain, because it looks just the same as our reptilian friends. And so this central part here is the more primitive brain. And this primitive brain is where all of the sensory input comes in. We have a nerve, we have 12 cranial nerves, and those come to the brain stem. So this is sort of like this thing on top of here, grows on top, like that. And down in here is the brain stem, and then down below here is the spinal cord. So the spinal cord also has nerves that come off, they're called roots. So it's somewhat like a tree. So right at the base of the spine, right at the base of the top of the spine and the base of the brain stem is right here, this opening in the hole of the skull. That's where the sort of the delineation between the spinal cord and the midbrain and the brain stem is. So the brain stem's like the stem of a tree, and then you've got the cauliflower and the brain coming off the top, which are the leaves and the limbs. And then we have the brain stem. So we have these 12 cranial nerves, and the cranial nerves are things such as the optic nerve. Optic nerve is what we see from. See through. We get input going into here first, into the brain stem. Then it separates out and goes to the cerebrum to figure out what it is, to remember what particular objects are. Same thing with the olfactory nerve. That's our sense of smell. It goes right into the brainstem. Our hearing, the auditory nerve, straight into the brainstem. We also have a nerve which is the 10th nerve, the vagus nerve, also goes from this spinal, the brainstem. It's all the survival brain. This is like all the things that we need to do just to basically survive. Not to like go to learn higher math, not to theorize on how to fly in the sky. It's just how to survive. Sex, eating, basic emotions are all in here. So this vagus nerve comes down and it goes to the digestive system. And if the vagus nerve is overstimulated, then it will suppress the digestion and you can't digest things. All right? So each part of the brain, each of these little folds is surrounded by meninges. So it's going in and out all over the place. It goes around every single cranial nerve. 3 layers. Each of those 12 nerves come out. It goes down the spinal cord. And it surrounds the nerve roots as they come out of the spine. So because it's like a saran wrap, if you pull on one side of a plastic wrap, the whole distance gets tugged. Right? And so if someone was wearing a saran wrap outfit and somebody pulled on your arm, then it's going to tug all the way up. So that's what we're saying about if the nerve gets tugged or twisted in some place in the body, it can affect all the way up to the brain.